Hello, everybody.
Brilliant.
Yes, I think it is.
Oh, I should be hiding everybody and just coming in. Or just
Yeah.
see. They're all
Hide
gonna
the
be-
reveal. Pretend that she's not here, that she's a special guest. I'm sure they do this on Parkinson and things.
So we can still hear you,
go.
Penny, but you
I'm
just,
incognito.
we'll bring you out as a surprise.
You'd just be throwing your voice and it'd be me just,
Bianca's the first one in. Great stuff. Well done, Bianca. Very good.
See,
Carol.
there are some people that obviously are ahead of time. They do wait in the wings, thinking, well, they'll come on eventually. And here they are. We're on early.
Very good.
Hi, guys.
There they go. There they are.
Yeah, you see,
Marvelous.
They're all going to start making comments.
Fiona,
it's nice when we make comments.
Rach. Oh, 6th Rach Mac.
Yeah, she's going to be sad about that one.
She is going to be sad. Oops.
Yeah, she's dropping. Lots of people
from America. It's all right.
So what's happened, lads? Any crack over the last week? What's been going on?
Well, I've got an amazing one. Just before we get into the really good stuff. Okay, here you go. You're going to absolutely love this. You're going to absolutely love this. This is a June 2022 report, which says, according to a survey conducted by the University of Guelph, Ontario Veterinary College, 66% of dog owners and 53% of cat owners feed their dogs and cats raw pet food. This trend reflected the search trend data. Searches for raw dog food have increased by 110% since 2017. And they are report, which is just a great way to start the evening. And this is reporting on a vet record study from 2020 by Sarah Dodd et al. Vet record 2020, and the title of the paper is An Observational Study of Raw Feeding Practices and How These Have Changed Between 2008 and 2018.
Cool. Gee, that's a good one. Oh, that's the first I've heard of that.
66%, guys. What a great way to start the evening.
Yeah.
66%. Just repeat that for everybody who's joining us. 66% are feeding some form of
raw pet food. Yeah, 67% for dog owners, 53% for cat owners. That's supreme, because normally it's kind of a 10-to-1 ratio of the dogs versus the cats. So it means the cat owners are catching up. Wonderful news. I'm sure that's because of all the work that we've been doing on this wonderful show, guys. I'm sure it is.
Marvelous.
Of course it is. It's due to RawPetMedics.
It is.
I mean, isn't that great? All without the support of the vet industry. Go ahead, Ben.
Yeah. Absolutely. I've got a really funny one for you this week. First, a shout out to Sam Broadhead. I saw 12 beautiful German Shepherd pups from her raw fed bitch with raw fed from weaning. Just amazing to see them. Huge German Shepherds. I'll give you a shout out quickly. But what I have is a funny addition to that. A client of mine, I'm not going to name her because I don't want to embarrass her, actually had to stop because she watches RawPetMedics while she's grooming, and she had to stop and then go back and actually replay Conor singing the Milky Way because he could not stop laughing. So guys out there, I think we're going to create a little TikTok of Conor's little Milky Way song. Karen's on it, I believe. So that's going out there live now that she said that. So Connor, what's painful. I was like all week.
What's been the highlight of my week? I can't really tell you what the highlight of my week has been. It's been extremely busy. I suppose on the piggyback of what Nick is saying, things are very, very busy. I am particularly busy on the email front, on the Facebook Messenger front. I did 2 lives this week already, and it's only Tuesday. I did a group of French bulldogs today, so you're just talking about allergies, and you can just sense it. You can just sense that it's getting extremely busy these days. So what's been going on? Nothing. I've just been nose to the grindstone. Everything's been very good and very, very hot for the last few days. So I'm just kind of trying to take it easy. Took Friday off, that kind of thing. But yeah, nothing to report, lads. Just working away. So it's been very boring our side. But, I am very excited about tonight, though. I'm very excited about this lady tonight. We have got I'm very excited. Nick, you can introduce her when the time comes. But before we do, guys, we're on Patreon.com/RawPetMedics, and that helps us very much. The price of a cup of tea or a pint if you can afford it. That's great. Really helps us this side to get the show going every week. If you can do it, great. If you can't, don't sweat it. We're going to be here no matter what, bringing you these fabulous guests like Penny. But can you tell us a little bit about Penny before we bring her on, Nick? Who's Penny?
So I was contacted by this wonderful person called Dr Zoolittle about 2 weeks ago, and she said we're doing a summit on pet and owner both. Longevity, would you like to be a part of it? And I said, absolutely, I'm absolutely all over it. So we had a chat, and she's a remarkable person. She's started as a zoologist and behaviorist, ethologist, and she made observations with her captive animals versus the wild animals, and noticed that the wild animals are so much healthier, and suddenly went, oh my God, we're killing our captive, our domesticated animals through many things, but through the food that we're feeding them. That led to a massive revelation for her. So she's done lots of research. She's very, very well read, and she's a fan of ours. But there you go, nobody is perfect. But apart from that, she's really got all this information at her fingertips. So I'd like to introduce Penny Wood, Dr. Zoolittle. Here she is. Here she is. There she
all the way
is.
down that end.
Penny.
Hey, Penny.
Thank you, guys. It's awesome to join you all.
It's amazing. It's great to see you. So listen, Penny, it's really great that you can be here. You've just finished filming. You're squeezing us into a very tight schedule. I couldn't believe it. You were writing emails to me, like really boring business emails at 3:30 this morning. Do you never sleep?
Charged.
Do you never sleep?
Do you know, I learned about how dolphins sleep, right? And they put half of their brain to sleep at any one given time. So this hemisphere sleeps for a few seconds, then this hemisphere sleeps for a few seconds. So that is my idol. That's what I'm going to be like. So
nice. Just one closed eye and kind of like in stroke form. Okay.
Yeah. Everyone thinks I'm winking at them all the time, but no. I'm just
Amazing. Listen, so Penny,
about swans and birds too, don't they also do that? Close down one half of their brain and keep the other half open for.
I would well believe it.
Yeah.
And they're migrating.
I don't fully trust swans. I don't know where I am with swans. And horses, actually. Horses and swans and possibly monkeys. There's three animals, actually, that I'm not very comfortable around. Swans just seem to know what I'm at. I tried to feed them there 2 weeks ago and was accosted by them. And they've no manners. They just come up and just start jamming at the bag to get the food. Do you not find that with swans? Do you not think swans are...
Well, you know what, Conor? I've heard that they're pretty uncomfortable with you as well, which is why they attack you in the first
Did
place.
they say that to you? You're like Dr. Doolittle? We've got
I'm
Dr.
Doolittle. She's Zoolittle.
Yeah.
I'm Doolittle. You know, it's as simple as that.
So, Penny, do you want to start off with a bit of background? Like, what's ethology? What did you do in the background? Tell us a little bit about your background in canine cognition and sensory neuroscience. They sound absolutely cool. Give us a bit of background.
Absolutely cool. So, ethology is just simply the study of animal behavior. So, out of the science, you sort of had these people coming into behavior as a behaviorist. And they were people who were looking at behavior under artificial circumstances, artificial conditions in a laboratory. So Skinner and people like that. And then you had people more like Conrad Lorenz who were looking at ethology, animal behavior, the natural behaviors that they're doing out in the wild. And so ethology comes out of that. But then you have cognitive behavior and you have sort of more instinctive behaviors, the things that the animals just do without the forward prefrontal cortex processing. And I was more interested in the things that did require that level of brain engagement, the decision making, the problem solving, communication, interaction, personality stuff. So that's my background. And I took that into a very applied point of view, rather than writing the research papers that we all love to read, taking it to the actual zoo in front of the animals. And so using other people's science to make the difference and build those relationships in zoos, to improve animal welfare, to improve their quality of life, to enrich their sensory experiences. And it was while I was there that I was working alongside a lot of the vets, because again, they're part of the welfare team. And I was a bit surprised to find that the medicine that they were using was this Band-Aid approach. It was like, oh, here comes this flamingo who's presenting with bumblefoot. It's already established. It's a big deal. So we just give them some antibiotics and we do the thing. That may not be what they did, but they didn't heal the flamingo. This flamingo was a repeat offender. He'd come in 9 times with a bad foot. And then the same thing would happen with a lot of the other patients that were coming in for clinic. And I was just like, why aren't we healing them? Like, if that flamingo was in the wild, either he would have become coyote lunch or he would have gotten fixed. So what is it that they're doing? Because they're not all becoming coyote lunch or whatever. They're healing themselves. How are they doing that? It seems to be a better model than what we're doing with our very superior human brain, right? To fix them. So I started getting into, what are they doing? What is the natural healing modalities that work? What are they eating that's priming their immune system to be able to have the resilience to fight back? Because at the end of the day, and this was something that hit me like a sledgehammer, is it's no doctor, no vet, no drug, no food, no fancy pants therapy that heals anyone of anything. It is your own immune system and nothing else. You can support that. You can build it up and make it stronger. You can optimize it. You can biohack it to the nth degree. And I'm all behind all of that, right? But if you don't have an immune system that is functional, you're out of the game.
And would zoos not be feeding really high quality food to their zoo animals anyway? Would they not be up on nutrition for their animals? Where do you think that is? Where do you think that approach is in zoos? I would have thought that was...
Yeah, and you got to remember, zoos are a continuum. There are some really bad, dodgy zoos that need to shut down. They haven't got a clue what they're doing. They're putting them in concrete and all the bad things. Then there are state-of-the-art, phenomenal facilities investing massive amounts into research, conservation, and welfare for the animals, and improving not just the ones in front of them, but so many others as well. So zoos are just, they're not the same. So some will have dietitians and nutritionists and animal specialists on the food side as part of the team, and others will get advice from them. We like to share a lot in the zoo community. There's not necessarily bags and bags of money to, so those who don't have, we tend to share with those, so everyone gets the information. But we make mistakes. So monkeys, for example, we used to give them all this trash. Like back in the 50s, they got cream buns, and so did the elephants, and all this rubbishy food for humans, because we just like to feed them to make friends with them, right? Then it was like, okay, no, monkeys don't eat that. They eat fruit, so let's give them fruit. So we gave them lots of fruit in their diet. Problem is, we gave them human fruit, so fruit that had been cultivated for the human palate, and we like sugar. A banana that I buy in M&S or something is going to be a totally different banana that I go and pick out of the rainforest of Costa Rica in terms of sugar content. Yeah. So the monkeys were getting diabetes in captivity in swathes. Like, a lot of primates were going down with diabetes because they had too much sugar from too much fruit. So we're doing the right things, but it's you've got to then change again and say, okay, so we have a little bit of fruit and lots of the green stuff. And that's a great zoo that takes that on board. Unfortunately, there are kibble companies for zoos. I hate to say it. That
was my next question. Yeah.
There are kibble companies, and so you can buy monkey kibble, seal kibble, lion kibble, bear kibble, all the things. And I mean, you can imagine how much I hate that. And so I'm seeing the diseases, and this is what started to happen for me. I started to see the diseases. Your cat in the wild, your leopard out there, your lion on the Serengeti, whatever, is not dying from chronic kidney disease. They're not dying from hypothyroidism. You put that cat in captivity, that's exactly what's going to take them out. It was us that was doing it.
So when you've got that situation, because I see zoos really as restricting the environment of those animals, and just as some pet parents, without meaning to, restrict the environment of their pets, is that restriction the lack of their ability to explore and find things that can heal them or help heal them? Is that the issue, or is it something else that you're seeing, that actually you can still give them that restriction of environment, but yet give them other things to explore within that very restricted environment to heal them? How are you addressing that?
Yeah, great question. And it's both. So it depends on the attitude of the zoo, the keeper, the curator, the board of directors, whoever, as to whether or not they're willing to embrace a new idea. And some are more conservative than others. When we restrict the size, and we're so conscious about the size, we always look at the size as that's the contributing factor. Sometimes it is. For a polar bear, it absolutely is. For an elephant, it really truly is. For a meerkat, it's really not, right? Their value system is on the colony and the family and all the dynamics that happen with that, rather than how big is my patch of sand. They're not roaming species the way a polar bear is. So long as the zoo or the keeper or the pet parent, whoever is the captive authority, the person in charge of the captive environment, so long as you are providing options to the animal, that's the key thing. Options for sensory engagement, which is what I used to do I used to focus on with the mental health in captivity. Sensory engagement, enrichment of options. Here's a toy that smells like something. Here's, go and investigate that, figure this out, try this challenge, dig that hole. Okay. Same thing with medicine. So if we can give them the options and start to bring into their environment, here are 20 different dried herbs and teas that I, have bought, and human quality stuff's great because we know then it's clean, right? Especially if you're buying organic, please do. And we then supply that into the enclosure for the animals. We know then that they're going to interact with that, and what they like, they'll go towards. There's a universal rule across all living beings. What you like, you go towards. What you don't like or don't need, you withdraw from. If something's horrible, you're going to leave the place, right? So the herbs that they want to have, they'll ingest, they'll roll in, they'll rub, they'll crush, they'll get on them, they'll lick them, they'll sniff them, whatever it is. And the ones they don't need, they'll ignore. And if they really don't like them, then they'll get rid of them. They'll push them away, bury them in something else or whatever. So now they're giving us a whole load of information. It's like, you needed this. But they go one step further. They're even cleverer than that, right? I didn't have to come up with a genius plan of knowing exactly which one they needed, as long as I give them choice. But their choices will change each day according to their need, and they know what that is. So as long as I keep giving them lots of options, they'll pick a different thing, a different combination, a different dosing level, a different ratio. They're doing all the hard stuff. I'm just the facilitator.
Thing is, Penny, in the wild, they're going to have an almost infinite variety because of the different soil at the top of the mountain to the bottom of the mountain. Right. So the ants are going to be different. The forbs are going to be different. The bushes, the grasses, everything else is going to be different. So it's almost infinite, and they would be able to, through zoopharmacognosy, be able to say, right, I'm feeling a little bit halfway up the mountain today. Is it possible in the zoo? And I kind of know the answer. In a zoo scenario, it's almost impossible to do that. How does the zoo the zoo community cope with the fact that they can only give a limited, as well, but as good as they can, but a limited environment?
Anything's better than nothing. And choice is phenomenally empowering. So you're not only giving the access to the materials that they might want, even if it's sort of second best option, it's still better than zero option. But the ability for the animal to have that sense of gratification and achievement. I've found a thing, even though they didn't put it there, but they use their nose, their eyes, whatever, to go and find where we hid it for them, right? I found the thing that I needed, and now I'm using my skill set to dose myself accordingly, is better than none of that. And also, you've got to remember, we like to put up on the pedestal the wild and go, the wild, oh, it's the best place ever. The wild isn't always fabulous. This is why, sometimes you have the open door policy at the zoo where animals can elect to come to work today at the zoo. They'll come in from the wild and join the zoo for the day, and then they'll go out again, right? An open door zoo. They do come in because there are benefits to being in captivity. You've got a maid, you've got a butler, you've got a cleaner, you've got a cook, you've got all the household stuff to look after you, right?
Yeah.
But out in the wild, it's not like every fruit tree is in season and fruiting at that particular time. They might want the fruit off that tree, but they're going to wait 6 months for it to come into. So they've got to go and find plan B anyway.
Yeah. Okay.
Yeah. There's definitely a balance. Like, I mean, there's disease, there's hardship, there's winters, there's all sorts of things, and there's always predation. I mean, okay, the big cats wouldn't suffer too much of it, but there's always a risk. Other cats trying to kill their babies, other sort of stuff that just does not happen. So I can see how primates and that kind of those sort of animals would get fairly well used to it. I heard a great quote there in this book, The Omnivore's Dilemma, one of Nick's favorites, and Salatins was saying how when these grass farmers, they call themselves, guys that rear cattle properly, and he says, what you see when you look at a pasture, you just see grass. He goes, I see about 20 different species of plants. He goes, I see red and white clover, I see sweetgrass, I see this, that. He goes, now watch this cow. He goes, and she'll walk straight over, she'll select certain plants at certain times of the day, certain weeks, depending on what she needs, and she'll leave the stuff she doesn't really like. If you were to leave her alone, different species would grow because she likes certain things at certain times. So he says it's really particular to these cows and how and what they're up to and reproducing or not and that kind of thing. So yeah, that's interesting. It must be interesting that, like, if a cheetah grew up with certain foliage in Africa, would that not be the sort of foliage you'd love to offer the cheetah to roll around in? Or I imagine they eat their little bits of grass here and there. Do all big cats do that? That seems to be a very common thing in carnivores, no?
Herbs, yeah, cats love herbs because they're aromatic and they've got a good sense of smell, and they don't get any calorific value from their plant materials, but they can get the active components, the active chemistry inside plants to do medicinal effects or just the pleasurable side of things. So, they enjoy the smell of catnip because it elicits those things, and peppermint's the same, and so there's a bunch of stuff that is just for fun.
That's cool.
And so following on from that, because there's a big thing that you talk about with your longevity stuff of, how we can re-engage our pets to a longer lifestyle that sort of almost mimics wildlife. One of your early things was trying to get the wildlife in zoos to live longer like they would in the wild. But there's a lot of the veterinary industry which would sort of go down the route of, well, actually the wild isn't, as Conor was pointing out, isn't always the great place to be. You can get predated on, there's disease, there's injury, even when you're hunting, you could get injured seriously and end up. So how do you, is it truly something you've researched that you've got animals in the wild which are truly living longer? Because of that ability to have variety and choose their own sort of self-selection of healing and that side of things. Where do you get that research from? Where's that basis?
So it's a very messy situation, and this was something even as a kid I was looking at. I was like, Mum, why does the one in the wild live for less than the one in captivity, or vice versa? Because there was no clear pattern. And I was like, it didn't make sense to me. That's the same animal who has less birthdays or more birthdays. And it's not necessarily that they're going to live longer in one thing or the other. It's they're going to die of different things because of the environmental circumstances. So this is not a genetic driver. This is not governed by the species that you are and what genes you have. This is more than 80% governed by lifestyle and epigenetics. So the epigenetics can be turned on and off and controlled by your environment and your food, which is why diet is such a big deal, amongst other reasons. But only 20% or even less than that is genetically dictated. So the animals in the wild, when zoos first sort of really started taking off, Victorian era and the early part of the 20th century, the animals had horrifically short lifespans. You just have to read some of Gerald Durrell's books to discover just how quickly something that they'd plucked out of the wild was put in a zoo, and they're heartbreaking stories because people had no idea what they needed. They had no idea of the species biology, the natural science. As that skill set and that knowledge base has increased, we've done better and better in the captive environment. But like I said, we still make mistakes like giving them human fruit with way too much sugar in it. So it's the fact that in the wild, they don't die from age-related chronic degenerative diseases. They die from a broken tooth, which leads to a mouth infection, which leads to a bacterial influx into the bloodstream, which goes to the heart and gives them a heart attack in about a week and a half. Right? It's just like living life. Oh, I'm dead. It's that how it works. And yet in captivity, all I could see was living life, suffering, living life, getting sick, living life, getting sicker, getting sick. Medicine doesn't work. Side effects are kicking in. Oh my gosh, we have to put them down. And that to me was just unacceptable from a stewardship point of view of where they're keepers, we look after them, we've taken away their autonomy in many respects, right? This is a big responsibility from a welfare point of view, and it applies exactly the same with pets, right? We have taken away their autonomy to be a grown-up, functioning, self-directed, I make all my own decisions animal, and said, we'll make decisions for you because we know better, because we've got thumbs, because we can go shopping, because, right? So if we don't take the time to learn their species biology, if we don't take the time to look and find out that this is better than that, that's actually damaging. Don't believe the media hype or the advertising line, but actually find out, is this what an animal would choose if they had the choice? And there's your answer. So I encourage people to just...
So, Penny, that's a great segue. So we've got nutrition, we've got epigenetics, we've got longevity. Take us, if you would, and this is an opportunity for you to promote your fantastic summit, which is just coming along. But take us on a journey from those revelations, those insights, to where you are today, organising a longevity summit for humans and their animals. That's an interesting journey.
And it was a long journey too, if I'm honest with you. And this is why, in large part, I'm doing the summit, because I want people to be able to catch up quickly. I don't want to make them do 5 years of intensive research and reading all the things and doing thousands of hours of classes and so forth. But I had that sort of existential crisis thing where I put together what I knew about working in the wild with the animals, what I knew about working in cooperative care to improve their mental health, and all the things that were making such a difference. But sometimes, without fixing the underlying healing problem, we couldn't fix the psychological problem sitting over the top. Because if you're in pain, you're never going to be in a great mood, right? Just to really simplify it, but it's more complex than that. So you need to have both. And so I saw that, and then I started being told, oh, it's totally normal for your cats to get hypothyroidism and to get chronic kidney disease. That's normal. That's what we expect. That's what they die of. That's normal. And I sat there as a zoologist in that consulting thing and went, do you know what? It's really not normal. It might be acceptable in your world, but it is not normal. No animal is programmed to die of a particular disease. I'm sorry, I refuse that. And so I started out to figure out, what is it that is going to look after our animals better? What is it that's going to give them the health span and the lifespan that they deserve and that they would naturally have if all things were perfect, including if the wild was perfect too? So after studying all the modalities I could get my paws on, I rejected a lot of them. I collected a lot of the good ones. And then I just synthesized that in my head. And how does it make sense to me? And so I created what I call my facets of juvenescence. And juvenescence is the science of youth, of getting younger, of being vital still. And they categorize very nicely, and it's consistent across the board. It doesn't matter if you're a human, this works for you, right? You know.
Yeah, I mean, you're 64, Penny, aren't you? Isn't that what you said?
65. No, last week was 65. Yeah. See, so it works, right? So
incredible.
Everything that I can do for me, for my longevity, my health span, I can do for my pets. I might have to modify it a little bit, right? Because my cat is not going to sit there and eat broccoli in the same way that I'm going to. But the science of longevity is the same if you're a mammal, if you're a mammal, if you're a mammal. And what's even crazier is that the disease process of degeneration and getting a disease condition and the process of aging are the same. So if you knock one out of the ballpark, you knock them all out.
Ooh. How does I'm begging to ask this question? How does high carbohydrate kibble, promoted by the veterinary industry worldwide, how does that fit into epigenetics, longevity, nutrition of, say, a dog? Where does that fit in with you?
If you would like your dog to have half a lifespan, and if you'd like your dog to go to the vet loads and loads, and you spend lots of money, and if you'd like to cry loads because you see them suffering, then go buy kibble.
And get cancer over the age of 10.
Lovely. We're going to take that and use that as a soundbite for the next year, I think. That's a fantastic answer. Good stuff. So what do you recommend nutrition-wise for dogs and cats? I mean, this is one of the pillars. I see you've got a few other pillars. I see you're into some kind of cool mad therapies. I really want you to do a quick elevator pitch on stem cell therapy, because that's so interesting. I wonder if it'll help with my knee. But where are you with the nutrition thing before we leave it? What do you think dogs and cats should be fed day to day, roughly?
Right. Well, I like to say it like this: no wolf has a barbecue. They just don't. They just don't. We are the only ones who cook our food, right? And if you want your dog to be healthy and have all the, think how cool a wolf is. Like, a wolf's not just like he's all right. Wolves are an amazingly cool animal. They're in literature and mythology and all the things because they're super cool, right? Wouldn't you like your dog to have all those super cool things of having a pack and being a team member and problem solving and being crafty and and being fit and strong and all the stuff, right? Yeah, of course you would, because you love your dog. So give them what the wolf eats, because their digestive system, their biology, their internal stuff is the same. So don't give them a second-class thing, because they're not a second-class citizen.
Yeah, great stuff.
Yeah, always going to be hit, aren't we, by their dogs aren't wolves, but yet they still don't get the anatomy is on the inside the same. And it's not, the fact that slight genetic changes still not significant enough to change the anatomy that your dog has got. And
further to that point, you're exactly right. But further to that point, it's even closer for cats, right? Cats don't have that morphological diversity that we do in the pet dog industry, right? Because they still look pretty much the same. They're even more conservative to being what a lion is. And again, a lion isn't sitting there around the barbecue in the fire pit saying, "Oh, I'll tell you what, I'm going to roast that a bit more."
Yeah. I bet though, I bet if you gave a wolf a choice between a bit of cooked meat and raw meat, I wonder which one he'd go for, because in food trials, dogs will take cooked meat, because I don't deny that little blackening on the meat, it's a Maillard reaction, and it's tasty. It gets the tummy going. If vegetarians want to eat that stuff, it's a fact. I mean, I spent 10-15 years trying to avoid it, and now I'm back on it. But so I bet you wolves would like the cooked up, but I suppose it's over time what's good for these animals. Zoos were just absolutely central to getting this going. In 1930s, there was a guy called Coiler he was wondering why animals in the zoos were dying so quick in British and Irish zoos, and he was all about dentition, and their teeth were going rotten, they were getting disease, and they were dying of septicemia or whatever. And so he brought in the idea of meat eaters eating meat on the bone. And so he was the first guy to start doing it. He goes, these guys need to chew. He was the first guy to coin the word hassle factor. They need to keep their teeth clean. They need checkups. He said, but if they're going to be living longer times, they need meat on the bone. So that was the first kind of nutritional leap that I thought that's kind of handy. And the second one was when they started taking the hide off the outside horse legs they feed in Dublin Zoo. I think Dublin Zoo is one of the more advanced zoos. I worked there for a year. I was very impressed with it by the time I left. But so they would feed horse legs, but they used to take the skin off the outside, the hide off the meat, and then they started realizing that the big cats were suffering more colitis, gastrointestinal issues, and when you start leaving the hair and hide on, they suffered less. So there's a good study on that, actually, which I've mentioned a few times, but it's one of the few studies of carnivores where it shows actually no, it's the whole thing. You can't just take these bits out from the animal's life. At least leave them on and let him choose and tell you what's going to be going in or out. You can be guaranteed they'll eat not the whole thing, but a certain quantity of it. That's how they poo. It's how the wolf has this congested plug at his butt first before he has a poo. He's got this harder indigested material that comes out first, and the poo gets softer as it comes out. I believe. I haven't seen a wolf taking a poo, but
and there's an amazing vet in South Africa, Dr. Adrian Tordef, who has done incredible research into this same question, but with cheetahs particularly. The captive cheetahs getting these diseases and the wild ones not. And his very in-depth research, he's got a lot of papers and he does presentations, which I think are amazing, but found that cats need to have about 30% collagen. And the collagen is coming from the skin and the hair and the knobbly bits, the connective tissues around the joints. Cats aren't going to eat bones in quite the same way as dogs are going to, because their jaws are, again, a little different. But they still need to have bone. But it's the cartilage, the collagen in particular, and it was the deficiency, the very, very severe deficiency of collagen in the captive environment. And we see the same thing with pet cats. That's a big contributing factor. The second thing is hydration, because of course when you've got kibble, if there's no moisture in the food, you've got to draw moisture out of the body in order to soften that food down, in order to process it. And by the time you've done that, it's just junk slurry in the first place. So and because cats are a desert species, they're not designed to drink gallons of water. They just don't. They conserve their water in a different way, and they get it through their whole prey food. They get most of the moisture that they need from those mice and rodents that they're catching in the desert. So to put a bowl of water in front of the cat doesn't solve the problem. And so the kibble is creating massive chronic dehydration their entire life. It's no wonder their kidneys are clapping out, 10 years too soon. And that
absolutely
is so easy to fix.
So we've got species appropriate food. We've got stem cells, which Conor would love to hear about. What else are you going to be presenting and when is the conference, the presentations that you're going to be doing, Penny? From
So
the
the
22nd, I think you said.
That's right. So the summit starts on Monday, the 22nd. So it's Monday coming up now, and it's running for 9 days. We have talks from the scientific and the veterinary and the human medical community, all presenting where there's an overlap in this sort of concept of One Health, right? We're talking about mammals, just to clarify. So if anyone has a pet snake or a pet goldfish, we're probably not going to help sort that out this time. But across mammals, the One Health model is so real. And so what applies to human health, medicine, and longevity applies for the pets and vice versa. And so we're presenting a speaker each day from both sides of the camp and just advancing that knowledge. As well as food, gosh, let me think. We've had some, do you know, touch is such an incredible thing for longevity?
Touch as in Tellington touch, or touch as in
physical contact, like the other sense. We forget about this other sense. We're so focused on the ones that are all up here. So we've got talks about that. We've also got talks about how owning a pet, having a pet in your life, confers longevity onto the human, not just general immunity things, but it actually changes your brain and gives you greater brain resilience. We actually had a laugh in one of the talks about how doing handstands is even a thing for longevity.
No way.
But I mean, most of what we're talking about, you know, is a bit more scientifically based. But movement and exercise, I mean, it's so foundational that it's easy to forget. But if you don't move, you don't get rid of your lymphatic system, drainage pathways, right? So they don't have a heart pumping the fluid around the body the way the blood does. You have to use your body to move to get that out. And so pets that are sat inside all day, lying on a sofa because they've nothing to do because you're not here, maybe they don't have a brother or sister, maybe you're too busy to walk them, you know, all the things, right? That's conferring a lifestyle disbenefit onto them.
That's all comes back to that whole balance of the parasympathetic versus sympathetic system. You know, all of those things that you've just talked about there, about how to reduce that sympathetic drive of, you know, fear, flight, you know, all of the things that are going to really increase inflammation, and move them towards parasympathetic enjoyment, touch, you know, getting movement to help. You know, we all know that if you want to get your guts moving, go for a good walk, you know, those things just confer good parasympathetic tone. And that's the polyvagal theory stuff that sort of comes in. So many things, sound therapies can help, you know, that it's great. You know, a lot of complementary medicines go down that route, you know, when it comes to it. And it's great to hear that that's part of the longevity story in there, and how it reflects two ways, not just onto what your pet gains, but onto what you as a pet parent can have too.
Yeah, you got to hit them on all sides. I remember there's a not a zoo, but yeah, some sort of a zoo down in Photo Wildlife Park in Cork in Ireland, and they breed lots of cheetahs. They're known for their captive breeding program, very successful. And what these guys stumbled across was that big cheetah enclosure, you know, and the meat comes out hanging from a rope, and it shoots up the enclosure, and the cheetahs go bombing after it. It is spectacular to watch. So you get to see the cheetah running in something of a dramatic kind of chase. But they realized that the cheetahs were getting up. There was a bit of a mound in it, and the cheetahs were getting up in the mound. And when they could see the zebras walking, they were happy to mate. And so I'm sure this was the mound wasn't there by accident, but what they realized was a higher mound and more view of animals that they would like to predate. They see the animals and go, "Oh, that's a good time to have babies. There's loads of food around here." and so they get out. And I just thought that, I said, that's brilliant. It's just like, you've got to hit them on every sensory thing. They've got to see their food moving. And like, that's what makes kibble so miserable. It's just like, it's just this crackers in a bowl, a horrible, same taste, same smell, same texture every day in a bowl at the same time. How boring. Dudley is getting them, like, his food is just degenerating into random scraps and bits and pieces out into the garden, like less and less bowls, you know, random bits and pieces thrown out. And now I love seeing them foraging. So I bring little bits and pieces on a walk, and I get to sit down and use my phone for 10 minutes while Dudley's off doing something else. And but that stuff really works. Like, they need that. And in your allo grooming point, when we were in guide dogs, you weren't allowed to have your own dogs for the first 3 months. You just follow the trainers around 8 hours a day, 5 days a week for 3 months, and pick up poo. And so, but in that time, they told you to groom all the time, a lot of allo grooming. So the 3 or 4 dogs you were going to be getting, you spent a lot of time just grooming them. And so a lot of that, we had a few talks on the fascia underneath the skin, but just the Zoom groom we would use on longer haired dogs. and just that constant grooming, they gravitate towards you for more. It's so important. That's why prison is so cruel, because the idea of it is that isolation and that removal of touch is desperate for group living animals, and why a touch is so soothing when you're upset. It's why you touch yourself when you're it's one of the tells in poker. When someone starts touching their face, they're weak and they're about to do something weak, because they're looking for solace before they do something. So there's something to that touch thing, but God knows everybody listening here is touching their dogs enough. Let's face it. I mean, patting the dog is the easiest thing to do.
In the human world, and you could probably know this, but I'm just going to share it very, very briefly. There's a thing called the blue zones, which is almost like a natural experiment all around the world, from Sardinia to Greece to Costa Rica to California to Okinawa. And very simply speaking, these are the oldest productive living people in the world. That is to say, they're not all, reaching 89. They're reaching 89 and they're dancing and they're working and they're running up hills in, to get donkeys in and what have you. And this is bluezones.com. You can see this very, very simply. And they have right outlook. They have a purpose in life. It's their family, it's their farm, it's their community, it's downshift. In Sardinia, for example, they have every afternoon in certain regions, they have a little a 5 o'clock happy hour where you have a glass of wine. They eat wisely. They eat 80% of what they need to be absolutely stuffed. They tend to eat quite a lot of plants. They do eat meat, but they eat a lot of plants. And again, this wine at 5, many of them have alcohol as some part of their environment. They have the right tribe, the first loved ones, and they have a sense of belonging within their tribe. It's absolutely fantastic stuff. And if you say all of that stuff to a zoologist, they'll go, oh yeah, we kind of worked that out 50 years ago with lions and tigers and cheetahs, and yet we're only just coming to realize that that's what people need to be happy. It's not, nice holidays and fancy cars and shiny things. It's community and great food and sense of purpose and all that stuff. It's it's really very interesting stuff. And I imagine some of your speakers will be going down those lines, talking about the blue zones. Would that be correct?
Indeed they are. Yes, we've had that come up several times.
Yeah, that's interesting. What about stem cells? Tell me, is there anything you can do for my knee? Can I regenerate a Banjak's knee?
I was going to say a third leg. Don't do it.
He said he wasn't going to go there.
No, I absolutely love stem cells. I'm such a fan of them, and I think without question that this is the new face of medicine. This is where health and healing is going into the future, without a doubt. It's revolutionary. It's natural. There's practically no downside. The cost is the only thing at the moment, but like anything, it'll wait for it to become normal, and it'll be $50 to go to the doctors every year to just have your stem cell top up thing done. But to your point, that so we used to think that stem cells could magically become anything, because they had this sort of blank check approach. They can become whatever they need to be. And that's true if you're talking about in the test tube or in the petri dish or in the laboratory. When you put them in the body, they actually act a little differently, and they become more important for who they talk to and what chemical signals they put out than what they actually turn into themselves, what they decide to grow up into. So you get a magnification and a multiplication effect of these exosomes and of these, communication chemicals that are being sent out. So regeneration is 100% real. We take it for granted that if I had a gash on my arm, like let's say that, I've just wrestled a crocodile and I've got a great big gash on my arm here, that's going to heal. And none of you are going to be surprised when I come back 6 weeks later and I've got a wicked scar, but I'm not still oozing blood, right? There's a different thing. We don't think about the same thing happening in our organs, but they do. You can regenerate your organs, most of them. There's 1 or 2 exceptions, right? But with the right things, you can do that. And so if I didn't wash out that wound, if I just put a bandage on it with, crocodile gunky teeth marks in me and all the, then of course it's going to go fetid and I'm going to get septicemia and probably die, right? But so if I treat it the right way, clean it out, put a bandage on and let it do its thing, right? So the concept's the same. Look after your organs and heal them, they will heal and regenerate, and you'll get new for old. And that's what stem cells do, is they give you new for old. And I love that equation, because that means you can age backwards. That means you can spend more time doing the things that you like doing. Your body is fully capable of doing the things you like doing, because you're not there going, oh, my leg, lost in the war, I'm still limping because of it, right? So you can regenerate. And in fact, it can even reverse a broken spine, right? You think, oh, you've broken your spine, well, that's it, you're in a wheelchair forever. No. And so because there's two types of healing, very, very quickly, because I could go on forever about stem cells. I love them. Very, very quickly, when you're young, when you're a kid, you heal with stem cells. That is your healing modality. That's why kids bounce back from everything and heal super fast, and their scars fade in 5 minutes and all those things, because they're stem cell healing. As we get older, our stem cell production goes down. There's less of them, and they're also a bit less potent. And so their ability to do all the healing that you require is a bit diminished. So up comes this other guy who says, oh, look, I'll help with healing too. I'm scar tissue. I'm going to heal that bit there. The problem with scar tissue is it's like a plaster that sits over the thing, and blood flow can no longer get through that. That is a barrier. When you don't have blood flow going somewhere, it's dead. You're not going to regenerate and regrow that. You've solved the problem in a clean and antiseptic kind of way, but you can't. And that is how come people end up being paralyzed. It's not because their spinal cord got cut in half. No, you can't cut one of those things. They're so tough, you couldn't do it if you tried. It's because the scar tissue around where that injury site occurred means that there's no blood supply now coming into that area here, because you've got this, casing around it of scar tissue. Now you've got without the blood supply, you're not going to be able to feed the nerves and keep that stuff alive. So everything south of that turns off. Your legs don't go necrotic and die. They're not dead flesh, right? You'd have to have an amputation if that was the case. Different scenario. We're not talking about that. That's still living flesh. But because the scar tissue is there, you cannot get that stuff working properly. If you have an operation now and take the scar tissue away out of that site, scrape it all away, put the stem cell injection in instead, stitch you back up again, you will get your use of your legs back. Stem cells are phenomenal.
Oh, I'm interested. I heard that a lot of the sports people are getting their knees refixed and stem cells being used. Where do the stem cells come from?
Okay, you can be your own self-donor. So you can take a sample of your own cells. You then have to, it depends which country you're in, there's different legislation, all the things, right? So, but I mean, basically is you spin down the sample to separate out the other bits that you don't want from what you've taken. And you can then amplify those. So you multiply, you might have taken 1 million out, but we're going to make it so you've got 20 million that's going to go back in your body. So it just takes a couple of days to multiply your cells to get to that level again. So you've got a really potent dose. Then you put it back in. Now you can put it back into the bloodstream itself. So that would be a systemic approach. So now it's going to go all the way around your body, and those stem cells are going to find anywhere that there's a problem and start fixing it and sending out those chemical messages to rejuvenate and youthify your body everywhere. I mean, people are having stem cell facials instead of the surgery, right, for facelifts and things like that, because it'll do the same thing there. Or you can have it directly injected into, say, it's a joint. So, I mean, I nearly broke that when I was skiing one time and went over a jump crooked. So I've got a dodgy shoulder. But I could have the injection done particularly into the joint itself, so not into the bloodstream, but into the joint itself. And now it's particularly going to fix my shoulder. But you can also get stem cells from donors, the way you get like a kidney donor or a heart donor or a lung donor or something like that. So you match the types up, and with animals, it's pretty easy. They do have different blood types the way we do as well. They're not the same as our different blood types, but you get a donor match. Or alternatively, even better than that, is you take a cord sample. So cord meaning the placenta that connects the mother and the child. You don't have genetic information in the cord. So without the genetic information, you can't get a mismatch. So if you were to take fetal, and this would be ethically horrendous, but if you were to take fetal stem cells, you are going to have a rejection problem. And in actual fact, fetal stem cells cause the acceleration of cancer, because what's a fetus designed to do is designed to grow really, really fast and multiplication. So you put that in a grown-up, they're not designed to do that. You end up with cancer. It's a bad idea. Do not use fetal stem cells, right? Bad idea. But the cord blood, the cord that connects the mother, there's no DNA there. There's no ethical problem there. It is day zero. They're the youngest possible stem cells you can ever get. and they are at their fully pluripotent selves to be able to do all the things that you want. So you can take 10 years off your life by having cord sample.
Oh, I want some. And has this been done in dogs at all?
It is being done, particularly in dogs and in horses, because you have a lot of orthopedic injuries with the racing and things like that. So a lot of the work in stem cells at the moment is more on that injury side of things rather than the organ and the general longevity side of things. But they are still starting out to do a fair bit more research in organs, particularly for cats, which pleases me no end. So there'll be more and more of that. And in actual fact, there are some amazing zookeepers, kind of zookeepers and research scientists who work together to do stem cell therapy on some polar bears in captivity in the United States, and had amazing outcomes of healing as a result of that.
So there definitely in the veterinary industry, there is this ability now to collect stem cells from effectively bone marrow. So you need to take bone marrow. So unlike the platelet-rich plasmas that just are blood samples that are spun down to a certain degree and they take off the rich plasma, the stem cell is a little bit more invasive in they have to take bone marrow. So there is a downside to that. But enriching that, as you've said, and then effectively re-injecting it into the joints, there is variable responses noted in the veterinary industry, and I think that's down to how they're collected, how they're enriched, and how they're put back in. So there's always going to be, it's worth investigating which method they're using. What's your thoughts on some of these supplements out there? There's some algal supplements, things like that, to try and actually, rather than creating a solution that you're injecting back in, just to try and get the body to generate more stem cells and actually flood the system without actually having any surgery. Have you got anybody talking about that?
In the summit itself, no. That's not a topic that's coming up, but that is definitely a fascinating... Oh, actually, no, I tell a lie. One of our speakers was talking about phytoembryonic therapy, which is the plant stem cells, and how you can use the plant stem cells that you would sometimes ingest, but sometimes put under the tongue or absorb into the mucous membrane that way to get to the bloodstream, to co-opt the amazing power of the plant juvenescence as well. So that does come up in one, but we didn't have a talk specifically on stem cells there.
Sounds like the person to ask though, Brian. That sounds like anybody talking about phytoembryonic therapies is definitely going to have the answer to that question. There's a lady there, Sue Makepeace. My Westie had stem cell treatment on his knees. It worked really well, and the person above it as well. So that is very interesting. Would stem cells help with Cushing's? Is a question. I have no idea what the answer to that might be, but I imagine it's going to help with everything. I mean, is it not going to? Would it help with autoimmune diseases? Would it help soothe the raging immune system, I wonder?
I'll just step in for Cushing's, not so much, because it's usually a tumor side of things, whereas Addison's is usually an immune system attack which has depleted the organ. So actually stem cells coming in to re-enable normal cortisol releasing cells within the adrenals would be something that would be indicated for. But I think where you've got to deal with tumors, there's a slight difference there. Would you agree, Penny, or is that
I would. The temptation might be to think that now stem cells is the holy grail, the silver bullet, and the fountain of youth all in one. And as amazing as they are, no one thing does everything except your own immune system. So again, if you haven't got that up, and this is the big problem when you're doing organ transplants, is in order to facilitate the donor organ being kept in the body and not rejected, you have to massively depress the immune system of the recipient so that they don't reject it. The beauty with stem cells is you don't have to do that. If you're taking what it's taking from yourself and giving back to yourself, you have no problem at all with rejection. And if you're taking from the cord blood, you have no problem with rejection on that. So you can have your immune system fully optimized with supplements, with raw food, with clean water, structured water, hydrogen water, by getting rid of some of the environmental toxins, by having movement and exercise, by getting the red light therapy from sunrise and sunset. I mean, the list goes on. These are some of the pillars that I talk about with the work that I do. But all of that works together. And the nice thing is they're all complementary. That you don't ever get a thing where you can't take that drug with that drug because they hate each other and you'll get a side effect. everything works together, it's complementary, and you get a multiplication effect and also an acceleration effect. So typically, there's a sort of a speed bump that, once you start doing anti-aging and longevity extension through these natural things, you kind of go up, it gets faster and faster, you get younger and younger. I mean, you will eventually stop. You're not going to all become babies again and have puppies and kittens and no grown-up dogs, but it's really powerful stuff.
How long, so a lot of this stuff is coming from human kind of longevity work, and there's a lot of Silicon Valley who place a huge amount of value on this. A couple of names, obvious names, but these lads reckon they're going to live to 150 years, but they're 30 years old today, 40 years old. Is there any hope for a 40-year-old man to expect to live to 150 today? Is that sensible?
It's not unsensible, if I can say it that way. I think it's really very realistic for people who are alive today to have a life expectancy of around 120. I think that's really acceptable based on what I've seen in the science. Remember, I'm a consumer of this. I'm a scientist up the other end, the applied end. I'm not running the experiments. But what I'm seeing and reading in the papers and what I'm seeing coming through, and just the speed in which some of this is being discovered and brought into practice, absolutely. I don't know about 150. That's starting to push it a little bit, I think. But 120, yeah, no problem.
Wow.
Yeah, but guys, we've got to remember that we're dealing with health span, not lifespan. Yeah, the Americans have got very long lifespans. They're only about 38th on the list, but they spend more than everybody else on the planet put together. So, it's health span. I don't want to be around from 100 to 120 dribbling and wearing pants, wearing a nappy. Thank you, no. But if I'm good to go and I've got something useful to do and gardening and everything else, then absolutely fantastic. My children will be really sick of me by then, though. That's for sure. They're sick of me already.
I think you've just given everybody, all the ecologists out there, a heart attack because they're now trying to work out how they're going to deal with that excess population. I think we've used a massive amount of your time. Do you want to for the guys out there listening, just go through how they sign up to your conference coming up? Just give them the website that they should look at. How they get on to buy tickets.
Yeah, thank you, guys. If you do want to join us for these talks and take some of this information we've designed it to be very informal, very approachable stuff. Like, we haven't gone highbrow and deep into citing lots of papers. You don't have to sit there with pen and paper. This is stuff that you can learn some principles and go, oh, that's cool. I now know a thing. Plus, oh, this is what I can start doing today or tomorrow and bringing it into my life. So it's really, really approachable. If you'd like to join us for that, the URL, the website to go to is petandparentlongevity.com.
Oh, and at that
she
point,
got it out.
she got it out. Oh,
perfect.
She dropped out just at the wrong moment. But there you go. The website is on the bottom there. If you click on there, you'll find a link through to a conference. And please go along, enjoy. I think
free, lads.
Yeah,
it's free.
Yeah, there you go.
It's free. From next Monday. It's going to be fascinating. You can dip in, dip out. You can take it in your own time. It's not going to be a heavy, as she says, it's not going to be a heavy scientific thing, but it's going to give you the stepping stones if you want to go deep on something. It'll give you a lot of pointers in that direction. I think that was super fascinating. She's got a lot to say. I think we'll get her back maybe 6 months' time. Fascinating people.
The zoo work is so interesting, isn't it? Like, here's just another person with no foot in the kibble industry, no reason to say anything else, who has studied this stuff intently, is obviously very turned on with this longevity idea. And you ask her about kibble and processed food, and she's just like, yeah, if you want to, your dog to live half the time and spend your days crying and going to the vet every month. And I thought, oh yes, like that's everybody says the same thing. It's like, we're not making it up. So it's that's just, I was happy she said that, because we didn't, it's not like we had staged these questions beforehand. We make a deal of not actually grilling the people beforehand. We want to do it as it comes out. So I wasn't quite sure where she was going to be. I thought maybe, a little bit of kibble and add a little bit of fresh food. It wouldn't have been enough for me. I want, death to dry food and kibble and processed food and just go and make believe, So I'm really happy with that answer. So what a guest. So interesting. So interesting.
Can I just quickly do a quick shout out for all of our cat listeners out there, we've got on Friday, we've got another Feline Friday this Friday on Feed Transition. We're going to raise a few things of what she's talked about tonight, I think, when we're talking cats on Friday at 1 p.m. So it's an earlier start. You can see that also on recordings. And just again, another great thank you to all of those on Patreon that are donating and supporting us. It's great for all of you. Thank you very much. Hopefully we're answering some of your queries. Please do get in touch if you want anything else touched on in the lives.
And
Conor?
the thing is patreon.com/RawPetMedics. We always get told off by Pete for not mentioning.
Yes, yes. Top and tail, as he said. Absolutely. Guys, thanks very much. That was great. I enjoyed that tonight. I'm off to have a regenerating glass of resveratrol. And then I will let you know how I feel in the morning. I have been going to the gym a little bit more over the last week or two, and I'm telling you, it's just mad when you start getting into it again, whatever your thing is, if it's bloody walking or swimming or running or eating healthy. It's once you get over the first few days of this is a pain in the arse, I couldn't be bothered doing this. But once you get over that initial hump, it is addictive, and you can feel it. If you just listen to yourself a little bit, you go, I'm running up the stairs here like a young lad. Like before that, just like, and you're holding onto the banisters and pulling yourself up. It so quickly comes back, like the muscle memory. Your body is just dying to get into shape. If you can get over those first few days of, the habits and the temptation to go back to the old way, but 3 or 4 days of doing any one of those pillars she's talking about is, you do feel the difference very quickly.
In the blue zones, they say it's movement. It's all about movement. It doesn't matter what you do as long as you move, possibly every day. Yeah, if you're a walker, walk. If you're a runner, run. If you're a swimmer, swim. If you're a gardener, garden. Well, doesn't matter. Movement. Doesn't matter what you do. Just get that movement going. So amazing. Guys, that was super, super, super fantastic. I'll drop Penny a little line just to say thank you. And sorry that Brendan chucks you off 3 minutes before you were meant to go off.
You put her longevity short.
Nick, can you also we'll just put a little post up for everybody. They're all asking how to get onto the talks. We'll put the website link on the Facebook page. You can just click through on there and follow the instructions. You'll be able to join that conference. It's free.
Or have a look on Instagram or Facebook on Dr Zoolittle, Zoo with a Z, Dr Zoolittle. She calls herself Dr Zoolittle. So sooner or later, you're going to be find the link. I think it's going to be really interesting stuff. So it's the leading edge of human stuff applied to dogs and cats. Amazing. We all learn something. Amazing, guys. What are we doing next week?
Drinking wine. we're back to being less respectable, because obviously tonight we put the wine glasses down so that we could actually try and talk some sense. Still got outshone by a lady who knows a lot about
more than we. Us three put together.
So brilliant. It's great to see you guys. Look, just keep an eye on the posts. We will follow through. Oh God, it's Q&A. We're getting towards the end of August. Is it really?
It's not quite Q&A.
Surely.
It's not quite Q&A yet. I'm actually going to
no way.
I'm going to share a couple of paragraphs from an excellent book there that what was it called, Feeding Dogs, and I'm just going to share a couple of paragraphs on the longevity bit where the kibble companies were caught with their pants down making claims about longevity. Have you still got that there? I'm not looking at the screen.
I use it as a mic prop now.
Why? I've got 2 copies.
Not for any other reason than it's a good platform to put my mic on.
Good and solid. So I'm going to share this. I'm going to share this paragraph on this longevity claim that this dry food company made, and very bold. They didn't get away with it. But what is very alarming is that longevity is going the wrong way in dogs. There was a huge double study done by the UK Kennel Club in 2004, and then exactly 10 years later, 15,000 dogs in the first sample, 6,000 dogs in the second sample, covering over 150 breeds. And the news is all bad about longevity in pets. We've never fed them more high expensive pet food, more drugs, more products, and they're getting sicker, just like humans. And that's, I would say, the way the industry wants it.
Human longevity in the States has reduced in the last 2 or 3 years for the first time in 100.
That's right. Yeah. Exactly. Okay, maybe we could do case studies. Case studies would be a good one as well. We always threatened that we would run through a case study or two. We'll announce it in the next couple of days, guys. We'll have a think on it.
Okay.
Yeah. All right.
Right.
All right, guys.
Guys, Right.
Talk to you soon.